Bismillahirrahmanirrahim. SK Golden File number 19. In this Golden File 19, all August 2024 papers are included of all the major specialties. This is compiled and solved by Dr. Atif Azwal and Dr. Salahuddin. So we will discuss this paper from serial wise number. So our first paper will be of medicine, that was published on 20 August afternoon. So page number 1, medicine 20 August afternoon. Number 1 MCQs is about after the myocardial injury, what biochemical changes will be seen in the hypoxia. So basically what is hypoxia? When there is decrease in the oxygen, so to the myocardial or um, cardiac muscles. So what will the biochemical changes occur in the heart? So the heart will have anaerobic glycolysis and glycogenesis. That is the correct answer is option number C. Question number 2. A patient after 1 year of gastrectomy has anemia, fatigue and raised MCV, that is 110. He is also having peripheral numbness and tingling sensation. Which type of anemia is he suffering from? So it is basically megaloblastic anemia, as here MCV is raised, but also the gastrectomy is done, so there will be the part of stomach which helps in the absorption of vitamin B12, so that will be not present, so this will cause the pernicious anemia. So intrinsic factors will be absent to absorb the vitamin B12, so this will cause the pernicious anemia. Question number 3. Child awake from sleep and starts walking, it is termed as somnambulism. What is somnambulism? When the child um, awakes during the sleep and he walks. And what is sleep talking? It is known as somniloquy. Question number 4. A woman had a polyp in the cervix. It was removed and histopathology showed a portion of the polyp covered by squamous epithelium. The change is there is a polyp. A woman had a polyp in the cervix, so it is removed histopathologically and showed a portion of polyp covered with the squamous epithelium. So the change is known as dysplasia or metaplasia. So this will be known as metaplasia. Question number 5. A 29 years old female presents with the lethargy and irritability. For the last 5 years, her labs revealed HB of 9.6, MCV 70 and MCHC that was low with the normal WBC, and platelets count. The platelets count in WBC was normal, MCHC was low, MCV was 70, that is lower than the 76, and HB was 9.6. She was prescribed the iron supplement, yet after 2 months she has HB 10.2. Which lab investigation should be ordered to find the underlying cause of persistent anemia? So there will we will advise the HB electrophoresis, that explains any kind of abnormality inside the blood cells. Question number 6. Decrease in the potassium excretion is due to the metabolic acidosis greater than the renal failure. Renal failure is generalized term in this the acute renal failure can cause the hyperkalemia. When there is acute renal failure, that will cause the hyperkalemia. However, acute renal failure leads to metabolic acidosis, which will lead to the hyperkalemia, as by compensation hydrogen ions from the blood will start moving to the cell and the potassium will move out of the cell into the blood, so result the hyperkalemia, thus decrease in the tubular excretion. Question number 7. After the diapedesis, cytokines involved in the neutrophil migration is C5a, that will be C5a. So question number 8. Correct sequence of events for the neutrophil migration toward the site of acute is correct sequence, so that will be margination, rolling and um, rolling, adhesion and transmigration. Option number B is correct in this MCQs. So let me check whether this lecture is recording or not recording. Kindly give me a time. Yes. So we will discuss question number 9. Hormone responsible for the glycolysis, gluconeogenesis and ketogenesis. So which hormone is responsible for the glycolysis, gluconeogenesis and ketogenesis? So that is glucagon. That will be glucagon. Question number 10. Intrahepatic protein anabolism and extrahepatic catabolism. So who will do the intrahepatic protein anabolism and extrahepatic catabolism? So that will be done by the cortisol. Cortisol will cause the intrahepatic protein anabolism and protein extrahepatic catabolism. Question number 11. A patient, a 10 years old boy diagnosed with the tapeworm infestation. The drug of choice for the tapeworm infestation is niclosamide. Niclosamide. Niclosamide is given in the tapeworm infection. Question number 12. Least dilatable part of the urethra will be known as membranous part. So here is the explanation of this MCQs. External urethral meatus. It is the narrowest part. Prostatic urethra. It is the widest and most distensible part. Membranous urethra. It is the shortest and least dilatable part of the urethra. Bone marrow biopsy is done by the ventral part of the iliac crest. Bone marrow biopsy is done by the ventral part of the iliac crest. So first of all, there are different types of so the first it is the posterior iliac crust. So first it is done by the posterior iliac crust, that is easily accessible. Number second, it is done by the anterior superior iliac crust, that is especially in the obese person. Third, it is the spinous process of lumbar vertebra. Number fourth, it is done from the tibia. Number first, it is done from the posterior iliac crust, that is easily accessible, then from the anterior superior iliac crust, then from the third number from the processes of the lumbar vertebra, and the fourth, it is done from the tibia. It is used in the less than 1 year age. It is the medial aspect of the upper end of the tibia. Number fifth, it is done from the sternum, that is the manubrium or first part of the body of the sternum. Number 14, which hormone use the phospholipase C as the secondary messenger? So which of the following hormone use the phospholipase C? So it is used by the oxytocin. Oxytocin uses it. Question number 15. A 45 years old man with a long history of alcoholism presents with the severe epigastric pain. It presents with the severe epigastric pain, nausea, vomiting, fever, and increase in the serum amylase. Diagnosis of acute pancreatitis superimposed on the chronic pancreatitis was made. In this condition, which of the following type of necrosis is most characteristics? So it is basically long history of alcoholism, serum amylase, so it is fat necrosis. As amylase is present in the pancreas, and this is acute pancreatitis case. Number 16, type of fluid due to appendicitis is exudative fluid. Question number 17. Women with the hyperthyroid feature with the goiter diagnosed with the iodine deficiency. Cause of deficiency is B. Improper diet. Question number 18. Patient due to RTA road traffic accident sustained sacral injury. He presented with the overflow incontinence. Where is the lesion? So the lesion will be in the parasympathetic region. Explanation: injury above the sacral segment is sympathetic damage. Cause is spastic bladder, autonomic bladder, urge incontinence. Injury at the sacral segment. It is parasympathetic damage that will cause the atonic bladder, autonomous bladder, overflow incontinence. Note: neurogenic is common term used for both the spastic and atonic bladder. Question 19. A patient is having bleeding problem. Lab shows PT 14 seconds, APTT 60 seconds, that is prolonged, bleeding time 6 minutes, and defect in which of the following pathway? So that will be defect in the intrinsic pathway. Explanation: APTT is raised only in the hemophilia, that is the intrinsic pathway. APTT and BT raised in the von Willebrand disease. All the three will be raised in the DIC. Only bleeding time raised, so that is ITP or low platelets or platelets function defect. Heparin monitoring is done by APTT, that is the intrinsic pathway. Warfarin monitoring is done by the INR greater than the PT. Question number 20. For the nutritional assessment of the patient, we assess the nutrition from his weight loss by albumin and TIBC. Question number 21. Muscles of the forced expiration. So the forced expiration muscles will be internal intercostal and rectus abdominis muscles. Question number 22. In Christmas diseases, increased bleeding, what will be raised? So what will be raised? So that there will be APTT. All the hemophilia, A, there will be raised APTT only. In hemophilia A classic, there will be decreased anti anti-hemophilic globulin. In hemophilia B, that is the Christmas disease, there will be decreased plasma thromboplastin component of the factor 9 or Christmas disease. In hemophilia C, there is Rosenthal syndrome, decrease the plasma thromboplastin antecedent or factor 9. Question number 23. With the exception of sweat glands, parasympathetic system causes with what? Decrease secretions, promote secretions, increase heart rate, or decrease the peristalsis. So that will cause the promotion of the secretion. With the exception of sweat glands, there will be parasympathetic secretion system will cause the what? So it will promote the secretions. Paraneoplastic syndrome is caused by which of the following? So it caused by which of the following? So paraneoplastic syndrome is caused by the small cell lung carcinoma. Question number 25. On the ECG of a girl, you see sawtooth waves with P waves in the ratio of 3:1. Her pulse is regularly irregular. Which of the following has occurred? So when there is the pulse is regularly irregular and the P waves are absent, so this will be known and the P waves in a ratio of 3:1, so there will be atrial flutter. A surgeon performing thyroidectomy during the upper lobe thyroid surgery, nerve likely to be damaged in proximity with superior thyroid artery accidentally is. So there will be external laryngeal nerve injury. With the upper lobe there is external laryngeal injury. With the lower lobe there is recurrent laryngeal nerve injury. Superior thyroid artery related to the external laryngeal nerve. Inferior thyroid artery related to recurrent laryngeal nerve. Superior laryngeal artery related to internal laryngeal nerve. Most common nerve injury during the thyroidectomy. This is known as external laryngeal nerve. Most common nerve injured during the tracheostomy. That will be known as recurrent laryngeal nerve. Hoarseness of voice will occur due to the recurrent laryngeal nerve greater than the external laryngeal nerve greater than the vagus nerve. Question 27. A woman with the history of trauma to head and neck region having lesion on the tongue or protrusion of tongue deviated to the left side of the nerve most likely involved is A. Left hypoglossal nerve. A patient suddenly developed no oliguria even after the 3 dialysis session. Patient failed to have urine output. Creatinine is still 9.5. Biopsy shows the cortical necrosis and severe acute tubular necrosis. What is the type? What is the cause in this patient? So the cause will be irreversible injury. Question 29. 55 years old male with the past history of epigastric pain for which he was taking antacids was diagnosed as a gastric lymphoma. What is the most likely cause? So the most likely cause will be H. pylori. Question number 30. A young lady has gallstones which has caused the blockage of a bile duct. This will lead to increased fat contents of the stool. Question number 31. In hiatal hernia repair, which structure is at risk of damage? So, hiatal hernia repair, which structure is at risk of damage? So, at risk of damage will be vagus nerve. Question number 32. Congenital lower motor neuron lesion of facial nerve is most common because congenital lower motor neuron lesion of facial nerve is common because facial nerve will have C. Birth control. Question 33. Old man with the generalized body edema. Cause is A. Hypoproteinemia. Cause will be hypoproteinemia. Question 34. A lady cut her finger by knife while working in the kitchen. By which mechanism her vasomotor response increases? So her vasomotor neuron mechanism will increase with the C. Postganglionic C fibers. Explanation includes the postganglionic C fibers are automatic fibers that causes the vasomotor response to injury. Question number 35. A patient presented with the bilateral ptosis with muscles wasting on the mastication and decrease the voice until no voice uttered, diagnosed as the myasthenia gravis. Best test for it is EMG. Question 36. Right lung has bronchogenic carcinoma, middle lobe removed surgically. Segments includes A. Apical and lingula, B. Medial and lateral, C. Inferior basal, D. Medio basal and lateral. So when the right lung is damaged in the bronchogenic carcinoma, so middle segment includes so middle lobe will includes the medial and lateral segments. Question 37. A child had recurrent infections, and every time the Klebsiella is found, what is the diagnosis? When there is recurrent infection and every time the Klebsiella is found, so what will be the diagnosis? So the diagnosis will be SCID, severe combined immunodeficiency, B. Bruton A. Gammaglobulinemia, C. Common variable gamma globulinemia, D. CGD. So the answer will be CGD. I don't remember what is CGD. Kindly search it by self or at the last we will discuss. Question number 37. Question 38. Fanconi syndrome, a rare genetic disorder. The child with decreased ATP at PCT will present with the B. Glycosuria. So it will present with the glycosuria. Increase explanation increase glucose and amino acid excretion. Metabolic acidosis. Fanconi syndrome will have increased glucose and amino acids level. Amino acid excretion. Amino acid excretion will be there and increase glucose. There will be metabolic acidosis. There will be hypophosphatemia. There will be osteopenia. Question 39. The site of murmur for the aortic regurgitation is. This is number A, neck, number B, apex of the heart, number C, left fifth intercostal space, number D, right second intercostal space, number E, left second intercostal space. So the question number 39, there will be right second intercostal space. Question 40. Lady had a difficult labor at home in village. She was brought to hospital with history of pervaginal bleeding and oozing from the gums. For the last 10 hours, her CBC shows 6 gram per deciliter, platelets were 30,000, TLC was 24,000 with neutrophilia. The peripheral blood film shows the blur cells. Her PT and APTT were prolonged. Most likely cause is DIC. Disseminated intravascular coagulation A, ITP. Immunothrombosis idiopathic thrombocytopenia, C. Septicemia, D. Hemophilia, E. Postpartum hemorrhage. So it will be DIC. A option will be correct. Question 41. A person got stabbed on upper arm and floor of the axilla. Which of the following structure will be damaged? So he got stabbed on the upper arm and floor of the axilla. So there will be damage to the intercostobrachial artery. So there will be damage to the C, intercostobrachial artery. Question 42. A patient after the trauma, all muscles of her abdomen and chest paralyzed, still breathing. Which level injury occurs? So a patient after the trauma, all muscles of abdomen and chest paralyzed, still breathing. Which level injury occurs? So there will be injury to the below C5 level. Question 43. Early adolescents with a prominent forehead, everted looking ears, and long longitudinal mandible and hypergonadism is clinically diagnostic feature of Fragile X syndrome. Early adolescents with the prominent forehead, everted ears, forehead will be prominent, everted looking ears, and longitudinal mandible. There will be hypergonadism. So this will be the clinical diagnostic of Fragile X syndrome. Question 44 on histology shows the flask-shaped cells, multiple dendritic synapses in. There will be flask-shaped cells, multiple dendritic synapses in the D. Cerebral cortex. Number A. Substantia nigra. Number B. Cerebral cortex. C. Reticulate ganglia. D. Cerebral cortex. So it will be D. Cerebral cortex. Question 45. H2 receptor blocker is not of therapeutic value in which condition? That will be D. Is Zollinger-Ellison syndrome. Question number 46. Urinary abnormality associated with. So urinary abnormality will be associated with the A. Schistosoma mansoni, B. Tinea solium, E. coli, C. coli, D. Schistosoma hematobium, and E. Clonorchis senesis. So urinary abnormality is associated with the Schistosoma hematobium. Number 47. GFAP. GFAP means glial fibrillary acid protein, positive in the A. meningioma, B. astrocytoma, C. ependymoma, and D. medulloblastoma. So it will be positive in the B. astrocytoma. Question 48. A patient presented with severe metabolic alkalosis. BP was 150 by 90, hypertension, and severe sodium 150 milliequivalents per liter and potassium was 3 milliequivalents per liter. There is increased adolescent aldosterone level in his blood. A. Addison's disease. B. Primary hyperaldosteronism. C. Adrenal hyperplasia. D. Secondary hyperaldosteronism. E. Primary hyperparathyroidism. So it will be B. Primary hyperaldosteronism, in which there will be metabolic alkalosis severe and BP will be raised, that is 150 by 90 mmHg, and the sodium will be 150 milliequivalents per liter and potassium will be 3 milliequivalents. Question 49. A 38 weeks pregnant 38 weeks pregnant woman A 38 weeks pregnant woman visited her family and remoted a remote area, after which she developed the jaundice suddenly. Which type of hepatitis is most likely prevalent in the pregnant woman? So that will be hepatitis E. E option is correct. Number 50. Which of the following virus is most dangerous in case pregnant lady? So it is A. Hepatitis A, B. Hepatitis B, C. Hepatitis C, D. Hepatitis D, and E. Hepatitis E. So that will be more dangerous in hepatitis E in the female pregnant patient. Orophycal route, hepatitis A is greater than hepatitis E. Most lethal hepatitis, hepatitis D, most common in pregnancy, that is hepatitis A, most lethal and remote area in pregnancy, that is hepatitis E. Question 51. A patient 45 years old and previously normal lady start having dyspnea, dry cough, fever 3 months back, recovered for 1 month, after which she went on vacation, again developed the symptoms, which she got back to her Canaries. X-ray multiple nodular lesions was present in the lungs along all the zones, and the mechanism of her symptoms was due to A. Antigen antibody mediated reaction, B. Progressive interstitial lung disease, C. Mast cell degranulation, D. Complement mediated. So it will be A. Antigen antibody mediated reaction. Explanation overall. Okay. Question 52. Increasant in question number 52. So question 52. Increasant gamma glomerulonephritis antibody complex deposition on the basement membrane. Which type of hypersensitivity? So there is includes A type 1 hypersensitivity, B type 2 hypersensitivity, C type 3 hypersensitivity, and D type 4 hypersensitivity. So these will include the B type 2 hypersensitivity. Overall, glomerulonephritis has type 3 hyper type 3 glomerulonephritis has type 3 hypersensitivity reaction, but antibody deposited mention. So then there will be type 2 hypersensitivity reaction. 53. Posteriorly inferior limit of the lungs, which we called posterior inferior lobe, is at the level of, so it will be at the level of 10th rib. Number B 9th rib, number C 12th rib, number D 7th rib. So these will be of 10th rib. 54. In asthma, which one increases? So in asthma, there will be increase of A uh, forced residual capacity, B forced expiratory volume, C vital capacity, and D total lung capacity. So there will be increase of forced residual capacity. 55. Which factor sees an increase in the restrictive lung diseases? A. FEV1 by FVC, B. Compliance, C. Forced residual capacity, D. Total volume, and E. Expiratory reserve volume. So it will be that of A. Forced expiratory reserve volume by forced vital capacity. That will be increase in the restrictive lung diseases. What is question number 56 regarding the REM sleep? True is, so in REM sleep, what will happen? There will be beta waves. Question 57. Watchman presented with high grade fever. Hemoptysis effector molecule is toll receptors. 58. In normal functioning myocardium, C waves coincide with the A. Closure of semilunar valves, B. First heart sound, C. Closure of AV valve, D. Opening of AV valve. So there will be closure of AV valve. Question number 59. Farmer's lung is due to which of the following agent? This will be due to the grain dust. The farmer's lung will be due to the grain dust, sugarcane, C. Cotton fibers, D. Coal dust, E. Asbestosis. So it will be due to the grain dust. Grain dust causes the farmer lungs. Aspergillosis causes the farmer lungs with the granuloma. Rhinosinusitis, medial erosion and calcification of the lung. Inorganic dust causes the diffuse lung fibrosis on the X-ray without fever or cough. Question 60. Hemoglobin belongs to appear in which stage? So it will appear in the intermediate stage or late normoblast. Intermediate. It will appear in the intermediate normoblast. Early normoblast, intermediate, late normoblast, reticulocyte. So hemoglobin synthesis starts at the early normoblast, while prefer the proerythroblast if present in option. In intermediate normoblast, hemoglobin starts to appear. In late normoblast, nucleus disappears. Reticulocytes contains the highest amount of hemoglobin. Question 61. Which one is primary lymphoid organ? So what is primary lymphoid organ? That is thymus, spleen, lymph, tonsils, palatine tonsils. So that will be that of the thymus. Primary lymphoid organ is thymus. 62. A group of mice was taken and injection of plastic hydrocarbons was given. This will work as the initiator process. In process, the initiator will work as A. Slow process will take time. B. Permanent DNA damage. C. It is the last step in the carcinogenesis. D. Causes the colonal proliferation. So, when a group of mice was taken and injection of plastic hydrocarbons was given, this will work as initiator in the process. The initiator work as permanent DNA damage. 63. AC inhibitor given to a patient, what will happen? So when the AC inhibitor is given to a patient, so this will cause the A. Decrease renin and bradykinin, decrease angiotensin 2 and bradykinin. C. Increase renin and decrease the bradykinin. D. Increase the angiotensin 2, decrease the bradykinin. E. Increase the angiotensin and renin. So it will cause the decrease angiotensin 2 and bradykinin. 64. Neck veins normally do not distend. They distend when the right atrial pressure rises above 25, I think. So when there is the right atrial pressure where it rises when the pressure exceeds the 8 plus. Question 65. In hemostasis, the word gain is for A. Negative feedback. B. Exaggeration of the positive feedback. C. Exaggeration of the negative feedback. And D. Positive feedback. So that is exaggeration of the negative feedback. 66. Person with difficulty in swallowing. There was some white growth inside the esophagus with the pseudohyphae. Likely reason is A. Candidiasis. B. Aspergillosis. C. Histoplasmosis. D. Mucor. E. Rhizopus. So that will be that of the candidiasis. 67. A 50 years man presented with the HB 8.2 enlarged spleen, WBC raised peripheral smear showing immature myeloid lineage. What is the genetic defect? So that will be A 9 ratio 22, B 14 ratio 18, C 11 ratio 14, D 8 ratio 14, E 11 ratio 22. So that will be A 9 ratio 22. That includes, I think, chronic myeloid leukemia. 68. Which bacteria have no cell wall? So that will be A. Chlamydia, B. Mycoplasma, C. Klebsiella, E. coli, D. E. coli, E. flagella. So that will be Mycoplasma. Mycoplasma and Uroplasma has no cell wall. Question 69. A female and had aortic root dilatation up to 4 cm. Ocular examination showed the lens dislocation, mitral valve leaflet defect with a systolic leg defect in which of the following? So that will be A. Acquired deficiency of fibrillin, B. Inherited deficiency of fibrillin, C. Inherited deficiency of laminin, D. Acquired deficiency of spectrin. So that will be inherited deficiency of fibrillin. Question number 70. A patient after the RTA. Having fluent nonsense speech in its way is due to damage of which area? So that is A. Parietal lobe, B. Broca area, C. Angular gyrus, D. Wernicke's area, E. Frontal lobe. So that will be that of the Wernicke's area. Explanation: Broca's aphasia. It causes the motor aphasia that will be non-fluent, plus it will damage the area 44 and area 45, and it will be in the inferior frontal gyrus region. Wernicke's aphasia, this is the sensory aphasia plus fluent nonsense speech plus area 22 plus superior temporal gyrus. Global aphasia, so global aphasia causes both the Wernicke's and Broca's aphasia plus arcuate uh, fasciculus. Anomic aphasia, it will be mild fluent aphasia plus failure of word retrieval plus angular gyrus. 71. A fracture of head of the femur leads to the avascular necrosis of head artery. Involved is which of the following? A. Lateral circumflex, B. Descending branch lateral circumflex, C. Medial circumflex artery, D. Femoral artery, E. Tibial artery. So it will include the medial circumflex artery. Explanation: in adults, the head of femur is supplied by retinicular greater than the medial circumflex. Neck of the femur is supplied by the medial and lateral circumflex. In avascular necrosis of the head of the femur, there will be medial circumflex. So head of the femur is supplied by the retinicular greater than the medial circumflex, and there is the head of the femur due to the it will be the medial circumflex as there is no reticular artery. Neck is supplied by the medial and lateral circumflex. Avascular necrosis of the head of the femur is supplied by the femur medial circumflex. In child, head of the femur is supplied by the obturator artery. Question 72. While doing the surgery, splenic vessels need to be ligated. They are present in which ligament? So splenic vessels will be present: A. Gastrosplenic, B. Hepatosplenic, C. Lienorenal, D. Splenogastric. So it will be present in the lienorenal. Uh, Doing surgery, splenic vessels need to be ligated. They are present in which ligament? So they are present in the lienorenal ligament. 73. A patient with the tip of tongue carcinoma. First drainage of the lymph node is to the A. Submental, B. Deep cervical, C. Superficial cervical, D. Jugulomyohyoid, E. Jugulodigastric. So it will be so the first drainage of the lymph will be to the submental lymph nodes. 74. Lymphocytes normal percentage in the blood is B lymphocytes, A 50 percentage, number B T lymphocytes, that is 80 to 90 percentage, C B lymphocytes 90 percentage, and T lymphocytes 10 percentage, D T lymphocytes, that is 20 percentage, E B lymphocytes, that is 10 to 20 percentage. So there will be T lymphocytes, that is 80 to 90 percentage. Question 75. Sensory preganglionic sympathetic fibers travel through sensory preganglionic sympathetic fibers travels through A. Gray ramus, B. White ramus, C. Dorsal root, D. Dorsal primary ramus, E. Ventral primary ramus. So it will be present in the white ramus. Question 76. A mother has child of 10 years diagnosed with the meningitis, and now she asks that another two child 4 and 6 years old are at risk of the meningitis. How will you tell her the route of spread of the infection? So it will be A. Airborne, B. Sexual contact, C. Respiratory droplets, D. Blood, and E. There will be needle stick injury. So it will be through the respiratory droplets. C. Question 77. Which of the following represents the pressure difference that acts to distend the lungs? So it will be A. Intrapleural pressure, B. Airway opening pressure, C. Intrathoracic pressure, D. Transpulmonary pressure, E. Esophageal pressure. So it will be through the D. Transpulmonary pressure. Transpulmonary pressure is difference between the alveolar and intrapleural pressure. Thus, if it is increased, it is main factors that will cause the lung expansion or distension. 78. A man during a road traffic side accident suffer the injury to the cervical sympathetic chain, most likely change in the eye. So it will be A. Ipsilateral sweating, B. Ipsilateral pupil constriction, C. Mydriasis, D. Isohydrosis, E. Increase salivation. So there will be ipsilateral pupil constriction. 79. Ligament pierce at last during epidural is A. Posterior spinal ligament, B. Anterior spinal ligament, C. Supraspinous ligament, D. Interspinous ligament, E. Ligamentum flavum. So ligament pierce at last during the epidural is ligamentum flavum. Question 80. Neoplasia has parenchyma and microenvironment. Microenvironment has A. Stroma plus inflammatory cells, B. Stroma plus inflammatory cells plus vessels, C. Stroma only, D. Endothelial cells. So there will be stroma plus inflammatory cells plus vessels. How many percentage of daily caloric intake? So carbs gives us 4 kilocalories, that of fats gives us 9 kilocalories, alcohol gives us 7 kilocalories, carbs required 50 to 60 percentage, fats required inside the body 25 to 30 percentage, and that of the proteins required 10 to 20 percentage in the daily caloric food intake. So proteins require percentage of daily caloric intake is 10 to 15 percentage. Question 86. After the gunshot bullet enter above the manevrosternal joint and exit T4, which part will be least affected? So which part will be least affected? So the esophagus will be least affected. Number A, heart and pericardium. So it will be most exposed. B, arch of aorta will be exposed to the manevrosternal region. C, trachea. D, esophagus, and E. Thymus. So there will be D. Esophagus. Question 87. During the hip surgery, vessels to the head of the femur ligated. Which artery is the main source of these vessels? So this is A. Internal iliac, B. External iliac, C. Popliteal, D. Tibial, and E. Femoral. So hip surgery vessels to head of the femur ligated. Which artery is the main source of this vessel? So the main artery of this source of vessel is E. Femoral. 88. Transient adhesions of WBC to endothelium is A. Selectins, B. Integrins, C. ICAM, D. VCAM. So these are A. Selectins. Transient adhesions is done by the selectins, and while that of the firm adhesions is done by the integrins. 89. Patient having the traveler's diarrhea not responding to antidiarrheal drugs. Which drugs should be given? So A. Metronidazole, B. Erythromycin, C. Norfloxacin, D. Chloramphenicol, E. Doxycycline. So that is norfloxacin. Question 90. Niacin deficiency causes which of the following effect? So niacin deficiency will cause A. PNS effect, B. CNS effect, C. Epithelial effects, D. Limb effect defects, and E. Enzyme effect. So that will be E. B. CNS defect. Niacin deficiency will cause the CNS defect. And that of the 91, which hormone responsible for the increased gastric emptying? So for the increased gastric emptying, there will be B. Gastrin. There will be responsible for the increased gastric emptying. So the answer is B. Gastrin. Question 92. Patient has aphasia and upper arm weakness. Thrombosis involves which of the following artery? So when there is upper arm weakness and aphasia, you can't able to talk. A. Anterior cerebral artery. B. Posterior cerebral artery. C. Middle cerebral artery. D. Posterior communicating artery. E. Anterior communicating artery. So there will be middle cerebral artery will be involved, which causes the aphasia and upper arm weakness. Thrombosis. 93. The part of sperm containing proteolytic enzymes to digest the zona placida is acrosome. A. Capacitor. B. Head. C. Corona. D. Acrosome. E. Cumulus. So it will be acrosome D. 94, in which brain part neural activity increases before a skills movement. So which brain part neural activity increases before a skills movement? So that will be E. Cortical association area. Question 95. A patient presented with the Crohn's disease. For her treatment of remission, corticosteroids are given. What is the best for the maintenance of the remission of her disease? A. Methotrexate. B. Mesalamine. C. Azathioprine. D. Budesonide. E. Ciprofloxacin. So, a patient presented with the Crohn's disease, for her treatment of remission, corticosteroids are given. Which is the best for the maintenance of remission of this disease? So, azathioprine is best for the remission of her disease. Explanation: Crohn's disease induced remission, steroid first line, uh, aminosalicylates second line, maintenance of remission, azathioprine or markeptopurine. Alternative is methotrexate, ulcerative colitis, induce remission, mm, aminosalicylates first line, second line is steroid, maintenance of the remission, azathioprine or markeptopurine. Alternative is methotrexate. 96. Encrochalin steroid is the first line, and azathioprine or my maintenance of remission azathioprine. Uh, 96. A lady presents after a trauma in a lift. On examination, loss of dorsal sensation of the left foot with loss of dorsiflexion and loss of eversion at talotarsal joint. Which of the following nerve is damaged? So, which of the following nerve will be damaged? A. Deep peroneal nerve. B. Common peroneal nerve. C. Deep peroneal nerve at neck of fibula. D. Sciatic nerve lesion at mid thigh. So, there will be B. Common peroneal nerve. 97. Lamella forming minimum air blood barrier is. So, what will cause the lamella forming minimum air blood barrier? So, there will be A. Type 2 pneumocyte. B. Alveolar macrophages. C. Pores of the cones and D. Cilia. So there will be pores of the cone. 98. A person running in a marathon race. Blood flow to the non-exercising muscles is by A. Sympathetic cholinergic, B. Sympathetic adrenergic, C. Parasympathetic, and D. Local metabolite, E. Adenosine. So there will be a marathon race. Blood flow to the non-exercising muscles is by A. Sympathetic cholinergic. 99. A woman with the 5 weeks of pregnancy contracted the German measles. She consulted her obstetrician, worrying about her baby. Which is the most likely complication of the baby might develop? So there will be A. Aortopulmonary septal defect, B. um, congenital cataract, C. Deafness, D. Spina bifida, E. Mental retardation. So there will be B. Congenital cataract. Explanation: Rubella in pregnancy complication overall causes the deafness greater than the cataract. Rubella in pregnancy complication within the 5 to 6 weeks causes the heart defect, if specifically asked. So there will be heart defect, then they marked it. Rubella in the pregnancy complication within the 7 weeks will cause the cataract. Rubella in the pregnancy complication after 7 weeks will cause the deafness. Number 100. G protein phospholipase C increases intracellular concentration of A. Calcium ions, B. Chloride ions, C. Potassium ions, and D. Magnesium ions. So it will cause the A. Calcium ions. 101. Increased potassium level can cause which of the following? So it will cause A. Decrease action potential, B. Tachycardia, C. Flaccidity, D. Spasticity, E. Rigidity. So it will cause the flaccidity. Question 102. Adult polycystic kidney disease mode of transmission is X-linked, dominant, X-linked recessive, autosomal dominant, autosomal recessive, multifactorial. So it will cause adult polycystic kidney disease mode of transmission will be autosomal dominant. Adult have autosomal dominant while child have autosomal recessive polycystic kidney disease. 103. In normal distribution curve, the mean is greater than the mode. A. B. Mode will be greater than the mean. C. Mode mean is equal to mode. D. Mean is equal to median is equal to mode. So option number D is correct. Question number 104. Side effects of dicumarol is A. Delayed clotting. B. Increased bleeding time. C. There will be decreased clotting time. D. There is A. Abnormal clotting. So explanation is dicumarol. It causes increased purity or clotting time, increased bleeding tendency. Dimercaprol. It causes increased the bleeding time. 105. Massive blood transfusion leads to the massive blood transfusion will leads to the hyperkalemia, hypercalcemia, hyponatremia, hypocalcemia, hypokalemia. So massive blood transfusion will leads to the C. Hypocalcemia. And multiple mm, or continuous um, causes the hemochromatosis. Repeated transfusion will cause hypocalcemia and massive will cause the hyperkalemia. Question number 106. Patient with the ETT. Heat loss is by the A. Conduction, B. Convection, C. Radiation, D. Evaporation. So when there is ETT, there will be evaporation. Question 107. When accompanying the left anterior descending artery is which of the following? The vein which is accompanying the left anterior descending artery is that of D. Great cardiac vein. Great cardiac vein. Um, it causes the left anterior descending artery. It is continuous with the left anterior descending artery or left or in the anterior interventricular groove. B. A great cardiac vein. Some part courses between the left and right ventricle, called as the anterior cardiac vein. Anterior interventricular vein accompany the left circumflex and left coronary sinus. Middle cardiac vein accompanies posterior interventricular artery. Small cardiac vein accompanies the marginal artery. 108. Drug distributed through the aqueous diffusion is A. Morphine, B. Phenobarbital, C. Naloxone, D. Flumazenil, E. Digoxin. So, drug that is distributed through the aqueous diffusion is known as digoxin. Question number 109. Apex of the heart blood supply is by A. Marginal artery, B. Anterior interventricular artery, C. Circumflex artery, D. Posterior anterior descending artery. So it will be the anterior interventricular artery. Apex of the heart will be supplied by the anterior interventricular artery. Question 110. Primary villus consists of which cells? So the primary villus consists of A. Fetal endothelium, B. Mesoderm plus capillaries, C. Cytotrophoblast and syncytiotrophoblasts, D. Cytotrophoblast plus capillaries, E. Capillaries. So the primary villus consists of which of the cells? So it will consist of cytotrophoblast and that of the syncytiotrophoblasts. Primary cytotrophoblast are syncytiotrophoblasts. Primary will include the cytotrophoblast plus the syncytiotrophoblasts. Secondary will include the cytotrophoblast plus syncytiotrophoblasts plus mesoderm. Tertiary will include the cytotrophoblast plus syncytiotrophoblasts plus capillaries. 111. What does the PR interval shows? A. Ventricular repolarization. B. SA node conduction to the AV node. C. SA node conduction to the ventricles. D. Atrial systole. E. Atrial depolarization. 111. What the PR interval shows? So the PR interval shows the SA node conduction to the ventricles. 112. Atria stretch leading to the tachycardia. This is A. Herring-Brewer reflex, B. Cushing reflex, C. Brain-Bridge reflex, D. Sinus tachycardia, E. Chemoreceptors. So atrial stretch leading to the tachycardia. This is C. Brain-Bridge reflex. 113. S1 and S2 hertz sounds. S1 and S2 hertz sounds. The farmer has A. More frequency, B. More duration, C. Less dullness, D. More frequency, E. No difference. So explanation includes S1 hertz sounds has more duration and dullness than S2. S2 hertz sound has more frequency and pitch than S1. So S1 S2 hertz sounds the farmer has B. More duration. 114. The cause of the atherosclerotic usually is A. Endothelial injury, B. Hyperlipidemia, C. Chronic inflammation, D. Infection, E. Embolism. So that will be that of the endothelial injury. Explanation virtues triad. There will be endothelial injury, there will be stasis, and there will be hypercoagulability. 115. Nerve compression between the C5 and C6 compresses which of the following? So it will compress A C4, B C5, C C6, D C7, and E C3. So this will nerve compression between the C5 and C6 will compress which of the following? So it will compress the C6. Question number 116. Which factor should be more important in the descriptive studies? A. Age, B. Sex, C. Social limits, D. Smoking, E. Nativity. So there will be the B. Sex will be the more important factor in descriptive studies. Antidote for the opium is A. Ethanol, aspirin, naloxone, D. Acetylcysteine, E. Flumazenil. For the opium, the most important antidote is C. Naloxone. Question number 118. Intrinsic pathway activated by which factor? So the intrinsic pathway will be activated by A. 2, B. 7, C. 11, D. 10. So the intrinsic pathway will be activated by C. Factor number 11. Question number 19. 119. Treatment of severe thalassemia major is B. Regular blood transfusion schedule. 120. Zollinger-Ellison syndrome associated with which of these? So it is associated with the A. Decrease gastrin, B. Increase insulin, C. Peptic ulcer disease, D. Increase in glucagon. So Zollinger-Ellison syndrome is associated with which of the following? So it is associated with the peptic ulcer disease. Question 121. Polysynaptic synapses is related to A. Knee jerk, B. Ankle jerk, C. Bicep jerk, D. Cremasteric reflex, E. Withdrawal reflex. So polysynaptic synapses is related to C. To D. Cremasteric reflex. 122. A patient diagnosed with the atrial fibrillation. How will you manage the patient if he is hemodynamically unstable? Number A. Amiodarone, B. Flecainide, C. Sotalol, D. Lidocaine, E. Cardioversion. So patient with the atrial fibrillation, he will needs cardioversion and hemodynamically unstable. So he needs cardioversion. Question 123. What does the bacteria secretes which helps in the proliferation of new capillaries in wound? So A. Fibronectin, B. Phospholipase, C. PDGF, I forgot prostaglandin, degradation growth factors, D. Metallase, E. FGF. What does the bacteria secretes which helps in the proliferation of the new capillaries? So it secretes the progestin. It is PDGF. C is greater than the FGF. Question 124. A patient has complex partial seizures. How will you treat this patient? So you will give number A levetiracetam, B ethosuximide, C carbamazepine plus primidone, D valproate. So for complex partial seizures, you will treat it by giving carbamazepine plus primidone. Question 125. A patient developed a sudden weakness in the right upper and lower limbs and mouth. Oh, and the mouth was deviated to the left. Which artery is involved? So, which artery will be involved? A anterior communicating artery, B middle cerebral artery, anterior cerebral artery, middle cerebral artery. So, I think this is middle cerebral artery and lower limb, right upper and lower limb and mouth. So it is middle cerebral artery. C. Posterior circumflex artery. D. Circle of Willis. So it is middle cerebral artery. Question 126. A common tumor suppressor gene is A. BRCA, B. RET, C. P53, D. BCL, and E. WT1. So the common tumor suppressor gene is P53. Question 127. A hormone that increases the HCO3 secretion from pancreas will be A. CCK, B. Secretin, C. Gastrin, D. Somatostatin, and E. Glucagon. So, a hormone that increases the HCO3 secretion from the pancreas will be known as B. That is secretin. Question 128. A 9 months old lady was vaccinated 2 weeks back, now presented with the rash all over the body, fever, and CBC report showing HB 13.5 milligram 13.5 gram per deciliter. WBC is 6 into 10 and decreased platelets. Peripheral smear shows the large platelets. What is the diagnosis? So the diagnosis is A. Thrombocytic thrombotic thrombocytopenic purpura. B. Idiopathic thrombocytopenic purpura. C. SLE. D. DIC. E. Bernard Solier syndrome. So that is B. When there is vaccination plus low platelets plus gained platelets, that is the large platelets, so it will be ITP. When there is normal or slight low platelets per gained platelets, so there will be Bernard Solier syndrome. Question 129. Thigh was adducted medially. Thigh was adducted medially, rotated and flexed by A. Sartorius, B. Gluteus maximus, C. Semimembranous, D. Obturator internus. So the thigh will be adducted medially and rotated and flexed by Sartorius. Question 130. The diagnosis of colon carcinoma made many years back. CEA was raised that time. Patient came for the regular checkup. You advised CEA. Now, what is the role of CEA? A. For staging. B. For follow up. C. To confirm the malignancy. D. To cell differentiation. So, we will check the CEA level for the follow up. Okay. Question 131. Patient is taking oral anticoagulant. Which factor is used to monitor the effect? So when the patient is taking the oral anticoagulant, so we will use the to monitor the effect. So there is A. APTT, B. PT, C. Factor C level, D. Thrombin level, E. BT. So there will be PT. Patient is taking the oral anticoagulant. Which factor is used to monitor the effect? The factor used to monitor the effect is PT. For heparin, there is APTT. For warfarin, there will be oral anticoagulant, that is INR greater than the PT. Question 132. A patient has weakness, pallor, dysphagia, and fatigue. He is having low HB, that is 6 gram per deciliter, and peripheral smear shows the microcytic hypochromic cells. Suitable diagnosis is A. Thalassemia anemia, B. B12 deficiency anemia, C. Folate deficiency anemia, D. Iron deficiency anemia, E. Sideroblastic anemia. So a patient has the weakness, pallor, dysphagia, and fatigue. He is having low HB, 6 gram per deciliter, and peripheral smear shows microcytic hypoxia. So D is having D. Iron deficiency anemia. Question 133. Minimal change disease features are A. Non-proteinuria, B. Proteinuria, 3.5 gram, C. Resistant to steroids, D. Pus cells, E. RBCs greater than the 10 per horsepower. So that will be B. Proteinuria greater than the 3.5 gram. Mm, 134. A 35 years old female presents with 6 months history of fingers turning pale in cold that includes the Raynaud's phenomena, also having the mild dyspnea with no wheeze, with mild enlarged spleen. Creatinine was high, urea was also raised, ANA was positive, HB was 10, WBC and platelets counts were normal. Which antibody will be raised? So there will be A anti-SSA, B anti-SSB, C anti-centromere, D AMA, E anti-microsomal. So there will be C anti-centromere. Question 136. A 60 years old female presented with a high grade fever, headache, and chronic sign positive on LP. CSF glucose was 40 and neutrophils were raised. Which drug should be given? A. Ceftriaxone, B. Cefotaxime, C. Amoxicillin, D. Gentamicin, E. Amphotericin. So, 60 years old patient presented with the high grade fever, headache, and chronic sign was positive. So, glucose was 40, neutrophils were raised. So, neutrophils are raised in the bacterial infection. So, ceftriaxone will be given. Question 137. A 45 years old female presents with the bone pain, paresthesia in the lower limb. Her laboratory investigations were done and it showed the serum calcium level 2.60 millimole per liter. Inorganic phosphate is inorganic phosphate, mm, zero point 0.9 is also normal. ALP 385 is also normal, and the serum PTH levels were borderline raised, 6.1. So this is known as the primary hyperparathyroidism. Question 138. A 20 years old boy with the rheumatic valvular heart disease has been running a low grade fever for the last 2 weeks. To a in addition to a parastolic murmur, he is found to have the splenomegaly and clubbing. The treatment should be A. Injection cefatoxime plus metronidazole, B. Injection ceftriaxone, C. Injection penicillin, D. Injection penicillin plus gentamicin, E. Injection ciprofloxacin. So it includes the injection penicillin plus gentamicin. Question 139. Main objective for the screening test for the tumor is A. Proper compliance of the treatment, B. Early diagnosis of the tumor, C. Late treatment of tumor, D. Late diagnostic tumor, E. Early treatment of the tumor. So main objective for the screening test for the tumor is B. Early diagnosis of the tumor. Question number 140. Main function of the hepatocyte is the hepatocyte main function is detoxification of urea, B. Metabolism of drugs, acclimatization of drugs, and D. Decrease HB formation. So the main function of hepatocytes is B. Metabolism of drugs. 141 antibodies in the Hashimoto's thyroiditis are A. Antithyroglobulin plus antimicrosomal, B. Antimitochondrial, C. Antinuclear, D. Anti-Smith, E. Anti-centromere. So these includes the antithyroglobulin plus antimicrosomal. 142 a 20 years old female have malar rash and positive anti-dsDNA now develops the proteinuria and hematuria. The most likely cause will be A. Nephrotic syndrome, B. Amyloidosis, C. Cystitis, D. Glomerulonephritis, E. Lupus nephritis. So it includes the lupus nephritis. 143. A pregnant lady having the hyperemesis gravidum, which acid base balance will be present. So there will be A, metabolic acidosis, B, respiratory acidosis, C, metabolic alkalosis, D, respiratory alkalosis, C, mixed acid base. So this will include the C, metabolic alkalosis. 144. Female patient presented with the hirsutism, obesity, and buffalo hump. She is diagnosed as Cushing syndrome. Which other feature will be present? A. Hypotension, B. Hyperglycemia, C. Hypoglycemia, D. Decreased weight. So buffalo hump, these all are the signs of Cushing syndrome. So Cushing syndrome, there will be hyperglycemia. 145. A patient on the warfarin therapy. Which of the following drugs dose should be adjusted? So these includes A. Gentamicin, B. Heparin, C. Cimetidine, D. Macrolides. So these will include the cimetidine. 146. A patient started warfarin has have petechiae and ecchymosis due to deficiency of A. Protein M, protein C deficiency, factor 10 or factor 9 deficiency. So there will be protein C deficiency which causes the petechia and ecchymosis as the warfarin was started. Question number 147. 8 weeks pregnancy with affected disorder. Drugs given should be A. Lithium, B. Valproate, C. Haloperidol, D. Escitalopram. So the 8 weeks pregnancy with affected disorders, drug given should be escitalopram. 148. Hormone exhibit relation between the weight and puberty. So these includes the A. Leptin, B. Estradiol, C. Ghrelin, D. Progesterone. So these exhibit the relation between the weight gain and puberty. So this is the leptin. Leptin and estradiol both can be true, but leptin is better choice. Leptin makes you lean and ghrelin makes you gained or obese. 149. Fats transport from intestine is A. LDL, B. Chylomicrons remnants, C. Mixed micelles, D. Chylomicrons. So this will be chylomicrons absorbed as mixed micelles and transported as the chylomicrons. 150. A female presented with the pain in hands and joints with morning stiffness, most likely suffering from A. Osteoarthritis, B. Rheumatoid arthritis, C. SLE, D. Septic arthritis. So, a female presented with the pain in the hands and joints in the morning stiffness, most likely suffering from the rheumatoid arthritis. Rheumatoid arthritis will have morning stiffness present, while osteoarthritis morning stiffness is present if less than the 30 minutes. 151. A female lady presented with the complaint of fingers turning red, white, and blue on the cold exposure. This is due to the A. Sclerosis, B. Primary Raynaud's phenomena, C. SLE, D. Vasculitis, E. Secondary Raynaud phenomena. So it is due to the primary Raynaud's phenomena. 152. Hormone based pregnancy test detect. Home based pregnancy test detect A. Estradiol, B. Enzymes, C. Cortisol, D. HCG. So home based pregnancy test detects the HCG. 153. A patient is having the mitral valve disease. now presents with the fever, malaise, and fatigue. On examination, he was also having the splinter hemorrhages and splenomegaly. What is the causative agent of such illnesses? A. Staph aureus, B. Streptococcus viridian, C. Streptococcus pneumonia, D. Streptococcus epidermidis. So it includes the Streptococcus viridians. Question 154. Tricyclic antidepressant are prescribed to a patient. Analgesic effect of TCA is seen after the 2 weeks. After the 1 week, analgesic effect is seen after the 1 to 2 weeks, and antidepressant effect is seen after the 3 to 4 weeks. 155 55 years old lady with the mild hypertension wants the lifestyle modification. Advice shall be given is A. Salt restriction, B. Walk 1 mile a day 4 days a week, C. Bike riding 30 minutes 4 days a week, D. High salt intake. So it is B. Walk 1 mile a day 4 days a week. If the lifestyle modification asked, then B is greater. If salt restriction up to 6 gram per day is mentioned, then prefer that. If dietary modification asked, then prefer the salt restriction in all the circumstances. Question 156. A young boy had the fracture while playing the football. Later he presents with the swelling on the anterior thigh. Biopsy showed a bony trabeculi mass containing the hemorrhage. This is most likely due to the A. Metaplasia, B. Dysplasia, C. Anaplasia, and D. Metastatic calcification. So it is due to the metaplasia. 157. Lymphoid tissue with the eosinophilic cortex and basophilic medulla. It is due to A. Lymph node, B. Thymus, C. Spleen, D. Lymph tonsils. 158. So it is thymus. 158. Triceps nerve supply by triceps nerve supply is by the A. Axillary nerve, B. Long thoracic nerve, C. Radial nerve, D. Spinal accessory nerve, and E. Thoracodorsal nerve. So it is by the radial nerve. 159. A patient of HIV presented with the some purple rash on the forearm. Cause is A. HPV, B. HSV, C. EBV, D. HHV8, E. HHV2. So, a patient of HIV presented with the some purple rash on the forearm. Cause is HHV8. 160. A patient with the localized circumferential lateral wall infarct. Which artery is involved? So the A. RCA artery will involve, B. LCA artery will involve, C. LCX will involve, D. Marginal will involve, or E. Pulmonary embolism will involve. So there will be C. Left circumflex artery will involve. Explanation: inferior wall MI. It is caused by the RCA, and it occurs in the lead 2, 3, and AVF. Anterior wall MI, it occurs due to the lead V1 to 6. Lateral wall MI, it is due to the L1, AVL, V5, V6. 161. 25 years old patient having the depigmented skin lesion on the back lips and cheeks. There is a family history of diabetes. What is the suitable pathogenesis of this disease? So A. Local reaction, B. Abnormal keratinocyte metabolism, C. Genetic disease, D. Autoimmune. So there will be D. Autoimmune. 162. A patient with the dilated ventricles and having defect in the CSF absorption due to the defect in the A. Meninges, B. Ependymal cells, C. Epidural space, D. Arachnoid granulation, E. Choroid plexus. So this will be the D. Arachnoid granulations. 163. Axillary artery is formed by A. Basilic veins and vena comitaenses of the brachial artery, B. Cephalic veins and vena comitaenses of the brachial artery, C. Union of the basilic vein and cephalic vein, D. Median cuboidal vein. So it is A. Basilic vein and vena comitaenses of the brachial artery. 164. Residual volume always remains in the lungs due to as it is A. Increase in the alveolar collapse, B. Decreases alveolar collapse, C. Decreases the negative alveolar pressure, D. Increase the positive airway pressure. So it will residual volume always remains in lungs due to as it decreases the alveolar collapse. Question number 165. Mifepristone given to the terminate the pregnancy if it is A. Antihypertensive, antiprogesterone, C. Steroid, D. Anticarcinogen. So it is antiprogesterone. 166. A baby delivers at 32 weeks, now having with the respiratory distress for the lungs maturity. What drug should be given to a mother antenatally? A. Dexamethasone, B. Hydrocortisone, C. Cyclosporine, D. Betamethasone. So that will be the betamethasone. 167. Movement of brain with the skull limited by movement of the brain with skull limited by A. Falx cerebri, B. Tentorium cerebelli, C. Vessels, D. Sinus. So 167. Movement of the brain with the skull limited by falx cerebri. 168. Toxoplasmosis is caused by the parasite, which is epidemic disease 90% in France, 50% in USA, and latent toxoplasmosis with the latent AIDS now mostly present with which conditions? A. Pneumonia, B. Encephalitis, C. Diffuse lymphadenopathy, D. Genital ulcers. So it is encephalitis. It causes the toxoplasmosis causes the encephalitis. Question number 169. A patient had cough and X-ray shows the hilar lymphadenopathy, non-caseating granuloma. Defective cells are A. Neutrophils, B. Eosinophils, C. T lymphocytes, D. Plasma cells. So these are T lymphocytes, that is C. 170. A patient has asthma for 6 months. Cell involved will be A. Neutrophils, B. Basophils, C. T lymphocytes, D. Plasma cells. So a patient having asthma for the 6 months, cells involved will be the basophils. 171. In tonsillectomy, which structure should be preserved to prevent the hypoparathyroidism? A. Superior thyroid artery, B. Inferior thyroid artery, C. Parathyroid artery, and D. Tonsillar artery. In tonsillectomy, which structure should be preserved to prevent the hypoparathyroidism? So it is the inferior thyroid artery. 172. A patient went to the dental clinic for the dental procedure. He was known case of MI and suddenly collapsed. CT scan brain showed thrombosis involved which artery? So it is A. Middle cerebral artery, um, middle cerebral artery, B. Anterior communicating artery, C. Posterior cerebral artery, D. Anterior communicating artery, cerebral artery, and E. Branches of the basilar artery. Dental clinic, he known in case of the MI. Suddenly collapse CT brain showed the thrombosis, which artery? So mainly the middle cerebral artery will be involved. Question 173. An old age shepherd having the lesion on the forehead involving 2 to 3 basal layers with acanthosis and atopia. What is the likely diagnosis? So the likely diagnosis is A. Solar keratosis, B. Squamous cell carcinoma, C. Basal cell carcinoma, D. Pigmented nevi. So it includes the A. Solar keratosis. Question number 174. Noise includes the causes damage to A. Organ of Carti, outer hair cells, C. Inner hair cells, and D. Vestibular cochlea. So these includes the outer hair cells. 175. An old-aged patient with the generalized edema having increased transfluency of lungs in upper fields, flattened diaphragms, no evidence of infiltration, no history of fever prominent both the pulmonary arteries, prominent right border of heart. On the radiograph, what is the most likely mechanism involved in the pulmonary arteries? So these are A. Granulomatous vasculitis, B. Organizing the atherosclerosis, C. Aneurysm, D. Medial dissection. So these are B. Organizing the atherosclerosis. 176. Why the pulmonary edema mostly happens in the basal lobe of the lung? A. Resistance to flow. B. Lymph drainage. C. Decrease the arterial partial oxygen. Uh, D. Decrease the arterial carbon dioxide. So that is the C. Decrease atrial pressure of oxygen. Blood flow is lowest at the apex, highest at the base. Ventilation lower bowie at the apex, highest bowie at the base. V by Q highest at the apex, lowest at the base. Regional arterial PCO2 lowest at the apex and highest at the base. Question 177. A drug given to for the chronic use for the chronic needs monitoring because of low therapeutic index. Question 178. Which of the following is the H2 blocker? A. Cetirizine, B. Fexofenadine, C. Diphenhydramate, D. Cimetidine. So it is D. Cimetidine. E. Carbamazepine. So it is Cimetidine. 179. Women with the long-standing asthma and depressive disorders. Most likely immunological change is A. Decreased cytokines, B. Increased cytokines, C. Decreased acute phase reactants, D. Increased lymphocytic proliferative response to the mitogens. So, in long standing asthma and depressive disorders, immunological change will be increased lymphocytic proliferative response to the mitogens. 180 EDV in diastolic volume depends on A. Venous return, B. Stretch of the ventricles fibers, C. Total peripheral resistance, D. Stretch of atrium. So it is A. Venous return. Preload is determined by EDV, depends on the venous return. Afterload is determined by mean arterial pressure. Total peripheral resistance is determined by diastolic BP. After the RTA, 1.5 liters of blood is lost. There is decrease in the GFR and urine output. Which part of the nephron will bring back GFR to the normal? So it is A. PCT, B. DCT, C. Thin descending loop of Henle, D. Thick descending loop of Henle, E. Collecting ducts. So it is basically B. mm, Dis- distal convoluted tubules. 182. Loudness is determined by A. Active hair cells on the organ of Corti, B. Part of the basilar membrane deflection, C. Inactive cells, hair cells on the organ of Corti, D. Oval window deflection. So it is B. Part of the basilar membrane deflection. 183. Indirect inguinal hernia occurs due to the defect in the A. Conjoint tendon, B. Transversalis fascia, C. Lacunar ligament, D. External oblique muscle. So, indirect inguinal hernia occurs due to the defect in the conjoint tendon. 184. Bilateral damage to the hippocampus results in A. Disappearance of the recent memories, B. Loss of working memories, C. Loss of ability to encode events of recent past in the long term memory, D. Loss of all the memories. So it is C. Loss of ability to encode the events of recent past in the long term memory. 185. In facial pain, hyperacusis ganglion involved in A. Trigeminal ganglia, B. Geniculate ganglia, C. Ciliary ganglia, D. Pterygopalatine ganglia. So it is B. Geniculate ganglia. 186. Which cells will remain dormant in the female up to the age of 40? So, which cells will be dormant? So, it is primary oocyte, B. Spermatids, C. First polar body, D. Ovum, E. Secondary polar body. So, it is primary oocyte. 186. A lipid layer of cell membrane having the cholesterol in its structure. Function of this cholesterol in membrane is A. Intracellular attachment, B. Permits the ion movement, C. Solubility, and D. Phagocytosis. So, cell membrane having the cholesterol in its structure, function of this cholesterol is permits the ion movements. Cholesterol is made up of sterol, a type of lipids, and embedded in the lipids embedded in the bilayer, thus allowing in ion movements across it. 188. Hyperexcitability of neurons due to deficiency of which of the following in extracellular fluid? So it includes the A. Sodium, B. Magnesium, C. Calcium, D. Potassium, E. Chlorine. So there will be the calcium. Hyperexcitability of neurons due to deficiency of which of the following in ECF? So these includes the calcium. 189. Scalp layer related to infection or pus are A. Skin, B. Connective tissues, C. Aponeurosis, D. Loose areolar tissues, E. Perineum. So these are loose areolar tissues. 190. In the left circumflex blocked, which heart part affected? So A. Left atrium anterior, B. Left ventricle posterior, C. Right atrium, D. Right ventricle. So in the left circumflex blocked, which heart part affected? So there will be affected part of the heart will be left ventricle posterior. 191. Patient with the multiple jaw draining abscesses. What will be the seen in the microscopy? A. Granulomatosis, B. Granuloma with the abscess, C. Abscess only, D. All of the above. So there will be B. Granuloma with the abscess. 192. Stored blood has A. Thrombocytosis, B. Acidemia, C. Hypernatremia, D. Hypokalemia. So there will be acidemia. Stored blood will have acidemia. So this was basically the first lecture which include the medicine first paper, and that is ended. Thank you for listening to me. We will meet in the next lecture on the next day. Thank you.